Imagine heart disease as a busy construction site and the road to get to that construction site, which is really important, as the blood vessel. So if there's any damage in the way of potholes or maybe loads of debris and litter on the actual road itself, then the construction workers, Mary with her JCB and Mo with his dumper truck, can't actually get to the site for stuff to happen. So if that is blocked in any way, then the construction site is shut down and construction stops altogether. And that is what is known as coronary artery disease, or some people call heart disease, where blood literally cannot get to the heart. It's either restricted, or if it's stopped altogether, that is what happens in a heart attack. Now, as humans, there are three things that we can do to stop that road getting blocked or the blood vessel getting blocked. Now, two of them are actual damage to the road surface or the blood vessel wall, if you like. And then really the third one, which is the most important, is the debris that gets there, or the things that accumulate to block that road or that blood vessel wall. Now, the first thing that can damage the road surface or the blood vessel wall is blood pressure. And I want you to imagine this as lots of cars and construction trucks and all sorts coming on that road, and it just having really high volume of people coming through, which is causing a lot of damage to the tarmac, a lot of pressure on the tarmac. That's essentially what blood pressure is doing. If we are increasing the amount of pressure that's in the vessel, the shear force that's put on the blood vessel wall is causing more mechanical damage than it would normally. And that literally leads to little tears in the surface, or as we say, potholes in the road this time, that are there for potential for more debris to get into. Now, the next way the wall gets damaged is, imagine vandals come along every now and then and pour acid on the road. So obviously making it really weak, and the next time some trucks come along it, it's much more easy and crumbly for the tarmac to be damaged and more potholes to form. Well, that is the equivalent to smoking, which is chemicals that are released in the blood and cause chemical damage, or in this case acid damage for the example, to the blood vessel wall, again increasing the likelihood of damage there, potholes to form, so to speak, and more ability for the debris, or what I'll explain in a moment, to get into those areas and cause more blockage. Now, the final and most important variable is if those potholes get filled with debris and litter and it physically blocks the road or blocks the blood vessel so blood can't get past, that is the most damaging thing. Now, in this analogy, the litter is represented by a protein called apolipoprotein B, or ApoB for short. Now, you may have heard of things like good cholesterol and bad cholesterol, which doesn't really tell the story because it oversimplifies what good and bad is. It's probably a bit like a film where, maybe a Batman film, where the hero is actually sometimes portrayed as a villain, but actually does good in some circumstances and bad in others. That's how I'd consider the high density lipoprotein versus low density lipoprotein. It's not necessarily one is all good and one is all bad, and it's just often a bit oversimplified. However, what isn't that oversimplified is the ability of apolipoprotein B, or ApoB, to tell you your risk of cardiovascular disease. That is why this is the most important one, because even if you have reasonable blood pressure and you don't smoke, so that means that you aren't getting those potholes forming, if the ApoB level is high enough, then you've got enough litter and debris circulating that even if you don't have big potholes, the tiny little nooks and crannies it can find its way into, and that can accumulate enough to block the road or block the blood vessel later down the line. So when it comes to our risk of stroke and heart attack, there are some things that unfortunately we can't control, but these are the three really important things that are fully within our control to reduce our risk. So what can we do about it? Well, three things really. The first is to quit smoking, which is pretty obvious and you don't need me to tell you to do that. The second is to get our blood pressure to a good level, and also finally get our ApoB down to as low as physiologically possible. Now, you're probably wondering how to do that, which is why I created this playlist here that takes those two individually and helps you understand exactly how to do it and what way to go about it, and specifically where to aim for. And that's going to help you on your journey to mapping your health and reducing your risk.